everyone. My name is Katie Brumfield, and I am the Career Services Specialist at the Colorado School of Public Health. And today I am talking with one of our alums, BreAnna Teeters. BreAnna graduated from our school with an MPH in Health Systems Management and Policy in 2020. And BreAnna is going to tell us today a little bit about her career. So thank you for joining us, BreAnna.
Thank you for asking.
So can you just tell us what is your current job title and where do you work?
So right now I am a community resource navigator at the Center for African American Health.
Great.
In Denver.
In Denver. And where, could you describe kind of a typical day or maybe some of the projects you work on? Like what are some of your job responsibilities?
Yeah, so right now my main responsibility, I'm helping manage our center's work with the crisis counseling program, which is a program that's being managed by the Colorado Department of Public Health and Environment, but it's to help assist community members with accessing resources that are related to COVID-19 outcomes, so rental assistance, housing, food, and also like connecting them with mental health professionals. So that's within my main scope right now. Also, I'm kind of working as a liaison with a few different nonprofits that we're partnered with and kind of trying to grow that partnership and see what we can do as far as connecting our community with their work.
That's great. Wow. Very cool. And how long have you been in this role?
So I started, I think, about the second week of August this year.
And when you graduated in May, right? How long, tell me about your application process and job search process and how long it took. Well, I guess August.
So I didn't really start looking for jobs until after graduation, just with everything going on. I was just trying to finish class. But actually, I started really hitting applications in June. But for this specific position, I actually got sent it by one of my fellow student recent graduates, and she sent me the position, and she said it seemed like a good fit. So I emailed, and at first they actually said that they were in a hiring freeze. But then I waited a couple weeks and just sent in my application anyway, so it would be on file. And then I think it was probably within 2 or 3 weeks they actually let me know we're interested in scheduling an interview. And then did phone interview and then Zoom interview. And yeah.
And you've been working remotely since?
Yes.
How did the Colorado School of Public Health help you prepare for this career?
I think for me personally, just because I did have a lot of leadership positions and managing that with work and still other school assignments really helped. Also, I think some of the classes that I ended up taking, most of them being HSMP, those mandatory classes really helped. Like interpreting health policy research, that one was really good. And then also I took a couple classes at the bioethics center, and those have also popped up. I think with COVID-19, there has been a lot of discussion around, okay, what are the ethics of certain situations and us providing resources. So I was at the classwork and then also just managing everything.
Yeah, you were very busy while you were a student. BreAnna worked in our office. You were the president of student council. What else?
I did case comp.
Oh yeah,
for the planning team.
Yep.
And then on a few other committees.
Yes, lots of
helped out. Yeah.
Yeah, you really got involved, and you were the graduation speaker.
Yes. I did get recognized from that.
Oh.
Someone at CDPHE, she said, "You were the one who was their speaker, right?" And I was like, "Yeah, that was me."
Yeah. Well, I feel lucky because I got to know you really well, but You did juggle quite a bit of responsibilities, and I was always very impressed by your time management skills. I'm sure that helps. What advice would you give for someone that's looking to pursue a career in public health?
My advice would kind of be to try out opportunities in kind of the different areas. I've been into the public health, drank the Kool-Aid since undergrad, since that was also my undergraduate degree. So I had the opportunity to do work with nonprofits. I did some uh, pesticide um, exposure work, so environmental, biostatistic area, some health systems research during my MPH. So I think that at least helps you narrow down, like, okay, I kind of like this area, I'm interested in environmental health, but not in the form of doing exposure science because that's a bit much for me. But then also, I'm really into just doing the research area within health systems, but not as much as the management part because I don't like Excel. So it's cool to be able to have exposure in those areas because sometimes you read job descriptions and it's like, oh, I could do that. But if you've had any experience with it before, it's kind of a more I could, but do I want to do that every day? Because I know what that's like. So I think just trying as many opportunities as you can, just so you know what you like and what you don't like.
Yeah, I think it's so important sometimes to know what you don't want as well as knowing what you want. But yeah, that's really good advice. And now it seems like your role is really more community behavioral type position.
Yes, which is what did drew me to it in the first place. Since I haven't had as much community behavioral experience, I'm usually on the back end with research more so than actual community interaction. So that's been something I'm really, glad to have exposure to that too.
Yeah. Yeah, and I think it just really highlights how a degree in public health, you don't have to have a job that's specific to your concentration. Um,
Yeah,
you get such a great skill set that you really can work in all parts of public health.
definitely.
Well, great. Well, thanks for sharing your job and some advice with us today.